Okay, good afternoon, Dr. Sheba. Very, very congratulations for scoring such a good marks, and hopefully you will get a good rank also, and will get the branch of your choice and the college of your choice. So, just introduce yourself.
Thank you, sir. My name is Seba Miriam David. I did my MBBS from MOSC Medical College, Kolancheri, Kerala. I was a regular batch student in Bhatia starting from April 2020. And I've managed to get a score of 645 out of 800 in NEET PG 2021.
Congratulations again. And
Thank you, sir.
so, how are you feeling now?
I'm feeling very happy. Actually, I didn't expect the mark list to be out yesterday. I was actually watching IPL when suddenly I saw the WhatsApp message of our Bhatia group saying the mark list is out. So immediately it was actually a shock. I didn't expect it to come out yesterday. I was initially nervous, but once I saw my marks, I was feeling relieved. Finally, all hard work has been paid. God has helped me a lot.
Definitely. You know that I usually say that. In fact, this is the fact that whenever you work hard, definitely it is paid. Yes, God is there,
Yes.
and yes, I introduce a belief system in my students also. So I usually say definitely yes. If you have worked hard, it will be paid. Sometimes immediately, sometimes it takes time. So,
Yes, it takes time.
so
So
yes, please.
I would like to thank God. I would like to thank all my parents, and all my teachers at Bhatia. I actually had thought of not going for coaching after internship. I thought I could do it on my own. But then now, when I think if I wouldn't have joined for Bhatia classes, I would not have made it on my own. Actually, all the notes helped me a lot in revising in time. So I'm very thankful to each and everyone in Bhatia.
Oh, that's good. Any specific teacher, yes, you would like to mention? Yes.
Sir, all teachers have helped me a lot. I would like to thank you, sir. I did not know much about psychiatry during my UG days. I loved your classes actually. Even psychiatry is one subject I revised the maximum. Psychiatry and ENT, two subjects I revised the maximum. So psychiatry, I didn't know it was so interesting before. I wish I had attended your classes during my internship. I could have understood all the cases I saw in a better way. So I'm very thankful to you, sir, for all your motivation and your wonderful classes. Even the eGurukul 2.0 question bank, I completed psychiatry fully because I liked it so much. All the case-based questions. First time I was reading such cases in psychiatry, I felt so happy doing all those. And I would like to. Medicine is actually my favorite subject. It used to be my favorite subject from UG. So I would especially like to thank Samim Saif, sir, and all my teachers. Actually, I'm thankful to everyone for giving us such beautiful notes, which helped me revise a number of times, which helped me a lot in my NEET PG exam. I'm thankful to everybody.
Okay, that's great. That's great. Yes, Dr. Seba, whenever we talk about the study, yes, most of the interview are based on the study. Definitely, your hard work, your academic performance does matter. But what about the psychological issue we usually find? Yes, you encounter during the preparation, and yes, how we should handle that. Yes, my main concern to discuss with you is that. Yes, we can read. Yes, if you have joined any coaching, yes, they all teachers are good. I think that all teachers are very nice who are there. Yes, they work hard, but the psychological thing is the main concern. I found in many students that they are little bit disturbed before exam, that I don't remember. Actually,
Mhm.
they remember, but they feel
Yes.
like that. So how you handle that stress?
Sir, actually, I started my preparation soon after internship from April. So, being from a private medical college, I had a lot of apprehension about whether I'd be able to clear or not, because I hadn't attended even a single coaching or class during my UG days. So, I was very scared actually in the beginning. of whether I would be able to clear in the first attempt. So I was very anxious in the beginning. Even towards the end, the anxiety was there. And there are people around saying you should go for a job, you should be doing COVID duty, you should be doing this, you should be getting married. A lot of things happen. So in the midst of that, it's difficult to carry out what you want to do. So I'm thankful to my parents for being so supportive to help me achieve my goal. When I used to study, I used to take breaks in between. Like I used to take, in the beginning, from January, February, March, I used to follow, I used to make a timetable beforehand for 1 month. For example, if I'm starting to study for the month of January, I used to make a timetable for January, giving 2 to 3 days for each subject. So I made sure I finished that subject in 2 to 3 days. It was not possible to finish in 2 to 3 days for medicine and surgery. So there was a lot of stress I had in finishing medicine and surgery, because it is very difficult to remember. So I had planned in such a way as to do 1 hour medicine in the night and 1 hour surgery in the morning every day. All the 3 months I did that,
That's
and
good.
even till September I used to do that. So that helped me a lot in bringing down my anxiety. Final year subjects were the main sources of my anxiety. Whenever I think of it itself, I used to have a headache. So I initially I used to put it away, because after April I used to regularly do my classes notes. I made sure I completed my notes and studied that day's portions that day itself. I never postponed it. So and I also prepared for the cumulative tests and the end of class, post class tests that were being held. So in that way I was able to complete at least small portions from each subject. When I wrote my November aims, I hadn't completed half of my subjects. I was only prepared with second year, third year, and half, and only one fourth of final year. My first year was remaining, and a major portion of my final year was remaining. So I managed to get only a rank of around 4,000 in the last year November aims. So actually, I was feeling very depressed. Although I hadn't finished a lot of portions, I was feeling very depressed, and I was thinking whether I would be able to get through NEET or not. And a lot of people will tell a lot of things, that you are wasting time and all that. So, but I continued studying, and but before the July aims also, there was a little disruption to my studies because we had to go to another place, and that also added a lot of stress to my preparation. So again, when I wrote July aims, I got only 1,200 rank, so I wasn't able to do that well. So again, I was feeling a little depressed, that whether should I continue for NEET or go for a job, because that time many people had already joined for a lot of things. So I was feeling very stressed out. Then I used to practice deep breathing exercises, like you said in class, sir. So I used to do that. It used to help me. And some 2 3 days break I used to take after a long period of study, and during that time I used to do whatever I like watching a movie, or sometimes even IPL was there, so I used to watch IPL. Then last November also I watched, and I used to do things I like. So that helped relieve my anxiety to a certain extent. And then when this before this NEET PG, I had around 47 days left. So I classified my 47 days into tens. Like 47 has around 4 tens. So first 10, second 10, third 10, fourth 10. First 10, I used to try finishing a portion of the 19 subjects, like 2 subjects a day. So in 10 days, you kind of one fourth at least finish a subject. So I used to keep the morning for GTs and previous year question papers. So I was able to finish all the aims, all the NEET, and a part of FMG question papers also before NEET. And then by the end of 47 days, I had almost completed revision of all my subjects, except a few portions of surgery. So when I made a timetable and was able to stick on to it, that helped me reduce my anxiety to a very big extent. But then there was a problem with the GTs, that I was doing GTs, but I was not able to increase my number of correct answers. So I used to think, even before I'm still in the same position, I'm not improving, I won't get through NEET. I had all these negative thoughts coming into me. But then my parents helped me and supported me. And then I used to read psychiatry also about this anxiety control and all that. And so it helped me. Like, positive attitude is very important, that you what whenever you work hard, God will definitely reward you, even though you have not finished everything, or even though you have not studied the whole thing. I always had this thought that everybody else had finished studying and I'm the only one left. I had this thought, and
Okay.
especially when I opened Telegram, all some new questions I would see, and I'd say, oh, I've never seen all these questions. All these people have already finished studying and they are doing. So all the stress was there, but I was able to overcome all this by God's grace, and I've been able to get a good score.
Definitely, you told very informative things. Yes, I would like to convey one message from this interview, that just like Dr. Seva said, that she had so many episodes of or different phases in which we feel that we are not able to do. But if we have belief, yes, if we have belief that we can do, we can do. Yes, I usually say that our unconscious mind, subconscious mind, you should realize the power of unconscious and subconscious mind. Yes, I usually tell in my class. And yes, the purpose of interview is not just, yes, my purpose is that just to tell that if you determine and you overcome these phases of depression and these fluctuations, yes, you will definitely clear your exam with flying colors, as Dr.
Yes,
Seva has proved. Okay, Dr. Seva, many congratulations, and
thank
may
you, sir.
God bless you with all success in your life. And we, as a DBMCI family, are always there to help you. So, thanks a lot for coming and giving your advice to your juniors and other students who are preparing for further exams. Okay,
Thank you, sir. I'm very thankful.
okay, thanks a lot.
Thank you.